Hey there, my name is Greene. I'm a PharmD and certified functional medicine practitioner and clinical liaison of integrative medicine for Revelation Pharma. Today I'm going to cover IV nutrition therapy in women's health conditions and try to give you just a good 10,000 foot overview of how you might be able to use these nutrients in IV administration or sometimes other injectable forms specifically related to women's health. Now, just a quick disclaimer, the contents on this video are for educational purposes only and do not constitute as medical advice. It's not intended to be any sort of substitute for professional medical advice, diagnosis, or treatments with a specific patient. Please always seek the advice of a doctor, pharmacist, or other qualified health provider with any questions you may have, and never disregard professional medical advice or delay in seeking emergency care as needed. So, presentation objectives for today. We'll look at various clinical areas for support in women's health using IV nutrients, the different injectable nutrient options and mechanisms of action that they have specifically in women's health, as well as side effects and precautions, and then special precautions related specifically to women's health, such as during pregnancy. So some major clinical areas for support, of course, bone health. Then we got menstrual health, PMS, PCOS, menopause, a wide array of reproductive and sexual health areas, fetal development, and then many general health areas such as immunity, hormone balance, cardiometabolic health, muscle function, and a lot of these are intermixed and intertwined, such as hormones, for example, which can affect many of these areas. So bone health specifically. So here, the three of the biggest ones are, of course, calcium, magnesium, and vitamin D, which I have a little disclaimer here, just noting vitamin D is not for IV use. It's generally IM only in the injectable side. So just keep that in mind. So everyone knows that risk of osteoporosis and its complications is a major health concern of women, but it's hardly debatable at this point that calcium and vitamin D are critical in the fight to preserve bone mass and strength. Then magnesium is also a critical part of bone structure and is also a cofactor for alkaline phosphatase, an enzyme involved in bone mineralization. And while many people can get enough of these nutrients through diet and oral supplementation alone, in many cases injectable forms can offer useful additional support. So most people are deficient in optimal magnesium and vitamin D levels, and for purposes related to poor diet and or poor absorption can benefit from injectable forms at times. And vitamin D, is required in the absorption and utilization of calcium. And I'd also like to note that vitamin K2, while only available orally, has proven to also be a critical player in the calcium and bone health cycle by removing excess calcium from the vasculature and helping deposit calcium into the bone. And then other nutrients provide support in this bone cycle as well, including but not limited to folic acid, B12, B6, manganese, and zinc, for example. So then we've got general menstrual health, PMS, and menopause, which have some degree of crossover in what some of the root causes can be. Both general menstrual health, including PMS symptoms, as well as menopause symptoms later on, can be improved with appropriate nutritional intake. Many of the symptoms of PMS are similar to those of magnesium deficiency, oddly enough, and studies have shown that magnesium levels tend to be significantly lower in women with PMS than in controls. Correlated symptoms include anxiety, depression, irritability, headaches, and others. In both uncontrolled and double-blind trials, magnesium supplementation improved PMS symptoms significantly. Related to menopause, magnesium supplementation has been noted to enhance the beneficial effects of hormone replacement therapy and relieve many menopausal symptoms, including hot flashes, which were reduced in frequency by 47% in one study. Then pyridoxine exerts a number of effects that would be expected to relieve symptoms of PMS, including reducing adverse effects of estrogen excess. Most uncontrolled and controlled trials have found that B6 supplementation relieved various symptoms of PMS, including edema, bloating, headache, breast pain, depression, irritability, and possibly acne flare-ups. Then trials have shown positive results in PMS symptoms with calcium and vitamin D supplementation as well. So it's not just for bone health. Adequate vitamin D levels could also contribute to more optimal hormone balance during menopause. Then we've got polycystic ovary syndrome, or PCOS. So here are some major players that can help in that area. So alpha-lipoic acid, inositol, which is commonly in a MIC-B12 complex in the compounding world. Then vitamin D, again, not for IV use, but IM injections. And then N-acetylcysteine or glutathione on the antioxidant side. So PCOS occurs in anywhere from 4 to 25% of reproductive aged women, depending on the source you look at, and can have a very negative impact on quality of life. It's got a wide possible combination of symptoms, including infertility, anovulation, amenorrhea, menstrual irregularities, hirsutism, acne, male pattern baldness in females, obesity, sleep apnea, and enlarged ovaries with high incidence of cysts. Even though the basis is around increased androgens, it's thought that hyperinsulinemia and insulin resistance actually lies at the root cause even of the androgen mechanisms. So alpha-lipoic acid offers support here through strong support of insulin sensitivity and healthy blood sugar control. It has very strong anti-inflammatory and antioxidant effects that lend a large role in improvement of the insulin metabolic pathway. Then inositol has many studies showing a strong synergy with alpha-lipoic acid in supporting the insulin metabolic pathway, and thereby working on the primary underlying cause behind PCOS. This in turn can lower testosterone and other androgen levels while improving ovulatory function in women with PCOS. Alpha-lipoic acid is generally given as a standalone IV infusion, and inositol, on the other hand, via intramuscular injections of, for example, a MIC-B12 complex including methionine, inositol, choline, and B12. Then, very importantly, low to very low vitamin D levels are frequently associated with women having PCOS, as well as inflammatory conditions associated with it. Trials have shown that vitamin D supplementation appeared to improve menstrual irregularities and fertility in women with PCOS. While possibly not as related to improvements in insulin sensitivity, vitamin D's positive effects in PCOS might be more related to its anti-inflammatory effects, as well as its many effects on regulating the hormone cascade. And vitamin D, when injected, is given IM and never IV, again, due to its oil base. And weekly IM injections are common for some period of time before weaning off to just continuing on an oral vitamin D support supplement. Then N-acetylcysteine supplementation has shown in uncontrolled trials to decrease insulin resistance and androgen levels in women, improve hirsutism, and in some cases restore normal menstrual cycles in women with PCOS. This is thought to be largely related to its strong antioxidant capabilities in generating glutathione. And note that while most studies looked at acetylcysteine due to its better bioavailability when taken orally, when using the IV route, glutathione can be used directly via slow IV push or standalone infusion to directly increase glutathione levels and achieve these same effects. Then with PCOS, we've also got L-carnitine, magnesium, and selenium. So L-carnitine serum levels have been shown to be significantly lower in women with PCOS than in healthy individuals, and may have part in the insulin resistance typically at the root cause of PCOS. One double-blind trial with 170 women showed very significant improvements in ovulation and pregnancy rates. L-carnitine can be given via IV infusion or IM injection. And most people are considered deficient in magnesium levels if assessed by an appropriate test, such as intracellular white blood cell testing, and magnesium supplementation is highly associated with improving insulin sensitivity, which again lends support to the often root cause in PCOS. Then finally, with selenium supplementation, that's been shown in one notable study to significantly decrease insulin resistance, improve hirsutism, acne, and alopecia symptoms, as well as significantly increase the pregnancy rate from 3.1% to 18.8% compared to placebo. Selenium is typically given as part of a combination IV drip, and it does have to be dosed very carefully as therapeutic doses are at the microgram level. Now keep in mind that this list isn't an exhaustive list of injectable nutrients that can support patients with PCOS, but some of the most highly studied and understood. Any nutrient or medication that supports insulin sensitivity and healthy blood sugar levels has the potential to offer some level of support in PCOS. Then with reproductive and sexual health, so there could be a lot of causes here, and it depends on the root cause, but there are often similarities with PCOS. And manganese and vitamin C can be two of the best options here. So again, while the root cause can be extremely varied, there's often crossovers with PCOS. So the options we just discussed with PCOS are often effective in improving women's reproductive and sexual health by improving insulin sensitivity and blood sugar control and lowering chronic inflammation, which improves the overall health and function of the reproductive organs. So also notable is manganese, which does have limited documentation to observe improved libido and sexual performance in women. Then vitamin C has been shown in both typically low-dose antioxidant type of therapy as well as oxidative high-dose therapy to be potentially beneficial for women when emotional stress or anxiety contribute to sexual dysfunction. A double-blind trial showed a notable increase in the frequency of sexual intercourse in women supplemented with vitamin C compared to placebo. On a somewhat separate note, it's also worth mentioning that high-dose vitamin C infusions in combination with standard anti-cancer therapy in the first post-operative year for women with breast cancer showed significantly enhanced performance status and reduction of complaints induced by both the breast cancer and the related chemo and radiotherapy. So through the special oxidative actions created by vitamin C at high-dose IV infusions, such as 25 to 100 grams, it can kill cancer cells without harming normal cells. So just a side note there related to breast cancer on vitamin C, since with the high-dose therapy, that's an area that it can really help support, which of course can come back and support these other areas as well, including reproductive and sexual health. Then just looking at the nutrient options and support mechanisms. So we want to use ingredients or combinations that are supportive of the mechanism or mechanisms that we believe are involved in the specific women's health condition being looked at. So now we'll look at the specific nutrients and all the different parameters involved in them. So calcium, of course, one of the most well-known nutrients to support women's health. The mechanism of action, it does a ton of things in the body, but some of the critical ones in women's health: bone structure, muscle function, electrolyte support. It can even offer strong support in PMS. So IV dosing, just as one example of calcium chloride at 100 milligrams per ml, might often be dosed anywhere from 1 to 5 mLs in combination with a vitamin mineral IV drip. And then IM and sub-Q administration would be contraindicated here just due to potential local tissue damage. And the most common side effects would just be local tissue burning or irritation, depending on the tonicity of the IV drip. And then primary precautions: too much and or too fast can lead to cardiac complications. So since calcium is critically involved with the heartbeat and contractions of the heart, so changes in heart rhythm, arrhythmias, etc., could be possible. But again, that's usually with too much, too fast. So again, it's just too much of a good thing. And it is notably pregnancy category C. Specifically, PMS has been shown to improve mood and reduce water retention and cramping. And you do notably want to balance it with magnesium in most IV drips. So related to pregnancy, hypocalcemia can cause significant complications with pregnancy, but you must also be careful with IV administration of calcium during pregnancy because it can affect contractions. And then on the opposite side of hypocalcemia, hypercalcemia can also lead to significant complications with fetal development. So use during pregnancy should only be done with a careful benefit versus risk assessment by the provider. Then we've got magnesium, which we just noted was important to pair with calcium. So its mechanism in women's health, again, bone structure, insulin sensitivity, electrolyte support and muscle relaxation, energy support, and stress and sleep support, just to name a few. Some typical IV dosing with magnesium chloride, 150 milligrams per ml, for example, might be 1 to 8 mLs, again in combination with a vitamin mineral IV drip. Most common side effects, which are related to usually too much, too fast, once again, but flushing, sweating, hypotension, headache, nausea and vomiting, or even in extreme cases, fainting. But most of those are typically avoided just by simply using appropriate dosing and not infusing too quickly, and monitoring the patients appropriately. So, and magnesium, again, in pregnancy, only use as needed based on careful assessment of benefit versus risk, as it is pregnancy category D in the injectable form, and large doses or high levels of magnesium can lead to complications with pregnancy, including changes in contractions or risks to fetal development. So once again, even though it's a critical and necessary nutrient during pregnancy, too much in an injectable IV form, not used appropriately, can lead to dangerous complications. So just be aware of that. Then we've got vitamin D. So its mechanism of action, again, there are many mechanisms behind vitamin D, but some critical ones in women's health: calcium absorption, anti-inflammatory action, and hormonal optimization. The intramuscular dosing is typically between 50,000 to 200,000 units intramuscular weekly, and it's usually for a fairly short period of time, just to really get difficult to move levels increased before switching to oral support. And again, IV administration contraindicated. Since it's oil-based, it's a risk of oil embolus. Side effects, most common, are just injection site irritation, redness, and soreness. Other side effects are very rare. And as I mentioned just a minute ago, the high IM doses are really only meant for temporary use, usually for a couple of weeks to a couple of months at the most. And I, again, recommend simultaneous vitamin K2 supplementation, which would be done orally. But data has shown that an increased risk of breast cancer is highly correlated with 25-hydroxyvitamin D serum levels that are below 20 nanograms per ml. And in fact, low vitamin D levels are highly correlated with a high risk level of many chronic diseases in women. And while many lab ranges might indicate much lower as being quote-unquote normal, the Institute for Functional Medicine and many other experts generally recommend a 25-hydroxyvitamin D level between 50 to 80 nanograms per ml for optimal health. And again, vitamin K2, it helps synergistically to optimize the calcium cycle. So as vitamin D helps calcium absorption into the body, vitamin K2 helps to remove excess calcium from the vasculature and move it to be deposited into the bones, thereby supporting both cardiovascular and bone health at the same time. And again, it's only available as an oral supplement, and while it can have very minor blood clotting properties at high doses, it's distinctly different from K1 in its primary mechanism. And with pregnancy, just carefully test, monitor, and aim for normal levels. Very low or very high vitamin D levels could have negative effects on fetal development. Then we've got alpha lipoic acid. So its mechanism of action, generally a lot of times it's used in weight management, and it really helps with insulin sensitivity and blood sugar support. It's also an antioxidant, a chelator of dangerous heavy metals, and also helps with energy production via oxidation of fats. So the IV dosing is typically 100 to 250 milligrams IV over an hour, with 600 milligrams as the max in some cases. It does notably have low compatibility with other items, so it generally has to be done as an IV drip by itself. And just based on its effects on insulin sensitivity and blood sugar, the most common side effects are hypoglycemia and related symptoms. So that's, again, another reason to start with a lower dose, titrate up, and make sure to educate patients on hypoglycemia, the symptoms are, how diet affects that, how other blood sugar lowering medications might affect that, especially if they're a type 2 diabetic. Now with pregnancy, there's a lack of sufficient data, but alpha lipoic acid is naturally made by the body, and the most risk would come from any blood sugar challenges. So manage blood sugar well if used related to pregnancy. Then we've got glutathione. So primary mechanisms of action: antioxidant, detoxification, anti-inflammatory, and hormone balance. So it supports not only general detoxification in all cells and the liver, but regarding women's health specifically, it actually neutralizes cancer-causing quinones formed during phase 2 metabolism of estrogen detoxification. The IV dosing, as an example with glutathione, 200 milligram per ml, is usually between 1 to 10 mLs via slow IV push or as a single item IV infusion, just due to low compatibility. So you generally, to avoid burning, you want to dilute the push 1-to-1 with either normal saline or sterile water for injection. Most common side effects, although still rare, are respiratory difficulty, primarily if they have some sort of sulfur sensitivity, diarrhea, or flushing. But again, those are rare, especially if titrated up to assess tolerance. And then other notable nutrients important in detoxification of dangerous estrogen metabolites, just as a side note, include B12, folic acid, riboflavin, pyridoxine, choline, magnesium, and diindolylmethane, or DIM, which is a great supplement to help in that whole detox path with estrogens. Then we've got vitamin C, or ascorbic acid. So IV dosing and mechanism is vastly different depending on what you're trying to do. So in low dose, vitamin C is an antioxidant like we typically think of. So with ascorbic acid, 500 milligrams per ml, for example, that might be 1 to 10 mLs via IV drip, typically in a mixture of some sort with other nutrients. Then when we do high dose, it becomes an oxidant therapy or oxidative therapy. So again, the same medication, but we're using higher doses, so 50 to 200 mLs, which delivers 25 to 100 grams of ascorbic acid via slow IV drip. And that does have to be done very slowly. Osmolarity has to be checked, as it's typically a very hypertonic solution. So side effects, more related more often to the high dose. There's very little side effects with the low dose. But high dose could be IV arm burning sensation due to the hypertonicity, dehydration, and hypoglycemia due to some insulin effects that occur during high dose vitamin C. So precautions with high dose vitamin C, it is recommended to get a G6PD test to make sure the patient doesn't have that deficiency before starting that kind of therapy. It does again have a high osmolarity, so you want to use the appropriate carrier fluid type and size, which is on a case-by-case basis. And then in pregnancy, I like to mention, while it's not necessarily contraindicated, and especially normal doses of vitamin C would be considered safe and even helpful during pregnancy, I usually caution against the use of high-dose vitamin C during pregnancy just due to the harsh oxidative nature of high doses. So just a special note between the difference in the low and high dose. So that's just a general, I believe, good recommendation as far as just because high dose can, when it becomes an oxidative therapy, can be a bit rough on the body and probably not warranted in most cases with pregnancy. Then folic acid. So folic acid supplementation is of course recommended in safe doses during pregnancy to reduce the risk of birth defects. And although oral supplementation is typically sufficient, I'll cover how IV supplementation could be done here and where to be cautious. So research has noted that even though folic acid supplementation can be critical during pregnancy, it's also noted that taking more than 5 milligram doses, even orally during pregnancy, may actually reduce development of cognitive, emotional, and motor skills in infants. So while folic acid is essential during pregnancy, injectable forms and high-dose supplementation should only be done in cases of highly trained medical professionals assessing all benefits versus risks. Because when we look at the mechanism of action of folic acid, DNA synthesis, cell division, neural tube formation, red blood cell formation, amino acid metabolism, it does some critical things in the body that we definitely need adequate amounts of folic acid to support during a pregnancy, but it's one of those where too much of even a good thing can be a bad thing, so just be aware of that. And typical IV dosing of, for example, a folic acid 2.5 milligram per ml injectable would be 1 to 2 mLs in a vitamin mineral combination drip. The most common side effects, although still rare, could be taste alteration, hyperactivity, irritability, nausea, and sleep and GI symptoms. And main precautions, like I said, studies have shown even with oral supplementation of 5 milligram or higher doses to have some negative effects on pregnancy. So you really want to be careful with injectable high dose during pregnancy and really know what you're doing with the dose, because even though, again, it is critical in pregnancy, too much can also be a bad thing. So in general, just looking at special precautions in women's health, of course, pregnancy and lactation are the big areas. So I just want to make some special notes again there, since those scenarios always carry additional risks and considerations. So while most of these nutrients covered are part of a normal diet and they're required for proper fetal development as well as development after birth, of course, we at Revelation don't specifically make any recommendations for IV nutrition regimens during pregnancy or breastfeeding, and official safety standards aren't fully developed in many of these cases. So just be aware of that. So it's up to the individual qualified medical professional to look at all the risks versus benefits in any pregnant or breastfeeding patients. And while basic nutritional supplementation will rarely have significant risks in breastfeeding, even necessary nutrients like calcium, magnesium, folic acid, they can all have potential risk when dosed too high inappropriately during the pregnancy. So just remember that high doses via the IV route can have very strong effects similar to many prescription-only pharmaceuticals. So just don't take them too lightly just because they're nutrients. They can have very powerful positive effects as well as very powerful negative effects if used inappropriately. So in summary, I covered everything from the clinical areas for support in women's health with injectable IV nutrients, the mechanisms that they have behind women's health, the side effects and precautions, and then special precautions in women's health, such as in pregnancy. And this is by no means an exhaustive list of all ways to use IV or injectable nutrition therapy in women's health, but hopefully this provides you with some useful highlights from a 10,000-foot view. So here are ways you can connect with us. You can email sales at revcustomrx.com. You can call 1-800-547-1399 or check us out at revcustomrx.com. And here are some various areas that you can check us out on social media, as well as a lot of pharmacies in our network. So again, I'm Casey Greene, PharmD and certified functional medicine practitioner. I thank you for your time today and listening to IV nutrition therapy and women's health conditions, and hopefully this has been helpful. If you have any questions, please reach out to us at Revelation Pharma, and we would be glad to help you out.